Hi, everybody. Thank you so much for being here today. I am Dr. Perkins, a board-certified OBGYN, and today we're talking about, can urgent care treat yeast infections? Yeast infections tend to show up at the worst time, in the middle of the night, on the weekends, when your doctor's offices are all closed, and then you're wondering, what can I do? And can I just go to an urgent care? And the answer is yes. I'm going to talk to you about important things that I want you to know about this potential visit, though. In this video, we'll discuss what urgent care can actually treat when it comes to yeast infections. I'll tell you exactly when you need to see a gynecologist instead, and we'll talk about what urgent care cannot do and what to do about that. Now, most urgent cares can effectively treat yeast infections. This is not heavy medicine. This is not something that requires, like a specialist like myself all the time. And oftentimes, you may diagnose yourself for having a yeast infection without needing a professional. Urgent care is really good at diagnosing through an exam. They're really good at confirming it with testing, and they're really, really good at starting your treatment as well. The flexibility with urgent care, obviously, is that they're available sometimes until the wee hours of the evening. Some are available on the weekends. You don't need to call and make an appointment. You can just show up. There might be a little bit of a wait depending on where you are, depending on where you're located. They are accessible to you, which is the important and beautiful thing about urgent care centers. Now, when you go to your visit, they will talk to you. They will talk to you about your symptoms. They may do an exam, which means getting a pelvic or a speculum exam. Sometimes they may even have you do a swab on your own so that you can get a sample of your discharge. But they'll take a look and they'll see what's happening down there. Oftentimes, because symptoms can present themselves as a multitude of possibilities, it is important that we do additional testing like STI, sexually transmitted infection testing, as well as check for other things that can cause similar symptoms like bacterial vaginosis. And so at the urgent care, oftentimes they will do more testing beyond what your concerns are or beyond the infection that you think you have. The reason why this is important is because 2 out of 3 people are actually wrong in thinking that their diagnosis is what it is. 2 out of 3 times, if you think that you have a yeast infection, chances are that is something else and not that. So it's important that we test for a variety of things. Now, what can urgent care prescribe for you? Well, they can give you the oral treatment for yeast infections. I say diflucan, but that's the brand name. It is called fluconazole. And so it's a pill that works really, really well at curing and treating effectively a yeast infection. Sometimes you may need multiple pills, but these pills are not found over the counter, and so they must be prescribed by a professional within the medical community. They may also offer a vaginal treatment with a prescription grade antifungal that goes within the vagina. You can find very similar compounds over the counter, the monostats 1, 3, 5, 7 that are there, and different variations of them. But the urgent care can prescribe to you the prescription grade version of these ointments or creams that may go vaginally and treat a yeast infection. In general, we don't treat both ways with a pill and with a cream at the same time. It's one or the other, but an urgent care can offer you these options. And I'll actually take that back. Once in a while, or in very rare cases, we may actually treat with both, but typically we treat with one or the other. So when is an urgent care the right choice for you? If you have new symptoms, itching, swelling, change in your discharge, absolutely see an urgent care. If you've tried over-the-counter treatments and you're still having symptoms, and this is beyond 5-6 days of using the treatment, then you can absolutely go to an urgent care center to follow up and get prescription grade treatment instead. Of course, if you're questioning whether or not the symptoms that you're having is an actual infection due to yeast, that is a good reason to see the urgent care doctors. If you are pregnant and you're having symptoms, you have recurrent infections, or if you have underlying medical issues such as diabetes, in which you tend to have yeast infections quite often, these are all wonderful reasons to go to the urgent care. Now, when should you see a gynecologist instead? Sometimes you can have a very complicated yeast infection. It could be complicated because it's not responding to treatments. It can be complicated because the type of yeast that is causing your infection can be one that is resistant to the typical treatments. Sometimes during pregnancy, it's best to see a gynecologist for your treatment. And definitely, if you're having an infection that is chronic over time. Urgent care does not treat chronically. They're really good with treating things that are an infection in an acute setting, give you treatment and have no follow-ups with you. And so if you have chronic issues, recurrent infections that are constantly ongoing, we really want to be under the care of a gynecologist who will track your treatments, your testing, and your symptoms over time so that, one, you don't have to keep coming back in with the same issue, but really so that you can live life a little bit more comfortably. Urgent care also doesn't really handle the hormonal side of things and how you can add in and change your lifestyle to help to decrease recurrence or prevent infections from happening. And so an urgent care is such a great start. And so if you're considering going, please absolutely check them out. But if you're having anything that's chronic over time, please see a gynecologist. And what I also want to mention to you today is that if you are having recurrent issues with a yeast infection, it's very important that we try to make changes in our lifestyle that can help to reduce the likelihood of an infection happening. And so things like making sure that we don't stay in wet clothing, like when you go swimming, making sure that we allow the vagina to breathe by not wearing very tight clothing. If you're very sweaty down there, we want to increase the use of cotton underwear versus others. We want to decrease using a lot of pads and panty liners on a daily basis outside of your periods. We also want to decrease the amount of sugar in your diet. I mean, there are lots of ways that we can try to internally change the playing field so that the likelihood of developing a yeast infection is less. You know, we're very hormonal people, and the vagina responds to our hormones very, very well. If we control and manage and balance our hormones internally, oftentimes we can decrease the likelihood of a yeast infection happening. This sometimes can seem like it is a lot of work, but I'd like to help you in this journey by sending you a free copy of my ebook, Hormones Don't Lie. We're hormonal. We experience them all day, every day. And so with that, having my ebook can help you on your journey so that you are getting the help that you need right at your fingertips. If you'd like a copy of this ebook, click a link below. It is in the descriptive area and I'll send it your way. Thank you so much for being here today and thank you for listening. I hope you learned a lot. I'll see you next time.